name is Austin Calvert. I am an Odessa College student. I'm majoring in occupational safety and health. Today we will talk about carpal tunnel and back safety. First, carpal tunnel. What is carpal tunnel? Who can develop carpal tunnel? What are the symptoms of carpal tunnel? And what are the prevention measures of carpal tunnel? First, what is carpal tunnel? Carpal tunnel is a musculoskeletal disorder. It is the compression of tendons, nerves, and ligaments within the transverse carpal ligament. This puts pressure on the medial nerve. Who can develop carpal tunnel? Truly, anyone can develop carpal tunnel. Office personnel sitting at computers, they are the most likely to develop carpal tunnel. Mechanics, carpenters, any job that has repetition of wrist motion and or requires workers to hold their wrists in unnatural position for long periods of time. It is 3 times more common in women than men. Carpal tunnel affects, on average, 3% of Americans in the workforce. Since the workforce has grown, it has increased from 1% total to 10% of the workforce. The symptoms of carpal tunnel: pain within the wrist. That is the most common symptom of carpal tunnel. Numbness in the wrist because the medial nerve is being pinched by the carpal ligament. Tingling in the wrist is another symptom due to the fact that the medial nerve is being pinched by the carpal ligament. These 3 symptoms are more prevalent at night because you've been working all day, so therefore this is when the onset of these symptoms take place. You tend to shake your hand as if you were trying to make the ink in a pen go down to the tip, such as this. I know we've all done that before because our wrist was hurt, so therefore that is another symptom. Weak grip. If you've ever been to work for a long time and you can't grab onto what you're trying to grab onto, it's because of that medial nerve being pinched. Fatigue with repetition of an activity, such as you're typing or whatnot. Eventually your hand will begin to hurt and it will tire out a lot more quickly than a normal day. Now, the prevention measures. Prevention measures are something that we need to do each and every day when it comes to this kind of injury, because later on this will become a very, very big issue, not just with us, but with everybody, due to the fact that when we don't work, it affects our family also. Avoid repetition of activities such as hammering, typing, knitting. Use ergonomically correct tools. I know these aren't always available, so we have to do the best that we can with what we have. Use ergonomically correct equipment, such as an ergonomically correct keyboard that you would type with, or an ergonomically correct mouse that you would use on a day-to-day basis. Use wrist braces. If you have a problem, a wrist brace will keep your wrist at the correct angle and will help keep pressure off the medial nerve while you are doing a particular job. Do not use your hand as a hammer. Don't use your hand to hit anything. Use the correct tool for the job. Your hand is not a hammer. Rotate the job task depending on what the job task is. If you have another employee or another helper that can help you, rotate the job. This will keep the repetition of the job down low, and the likely of the onset of these carpal tunnel symptoms will be less likely. Other prevention measures. Other prevention measures will be when you try to flex your wrist. Before a job is done or begins, both, you need to stretch your wrist. You will take the palm of your hand and place it at the tip of your fingers, such as this. You will straighten your arm out completely and pull back, stretching the tendons, ligaments, and nerves within your wrist and loosening that carpal ligament and stretching it so there's more room within inside your wrist. Then you'll do the opposite. You'll actually place your palm of your hand on your knuckles and actually pull this way and push towards you. This will also stretch. You can do this, or you can actually take your hand and put on a flat surface such as your table and push down and actually bring your shoulder forward. However this is done, this should be done before each job task. And how you type also. If you're on a keyboard, you need to keep your wrists and hands directly in front of you. This is correct position when you're at a keyboard. Not this, not curved off, but directly in front of you like this. You want to keep them, your wrists straight. You don't want to bend them like this. You want to keep them straight like this and have your fingers bent, because that's natural for your fingers to be bent. Now, why should we prevent carpal tunnel? Carpal tunnel is very painful. You will eventually need surgery if the pain persists, the numbness persists, and the tingling persists. You can have surgery or you can get injections. Either way, that is not good, because you're going to be in pain yet again and you're going to be out of work. This is why you do not want to develop carpal tunnel, injections or surgery. Each year, millions of workers are affected by carpal tunnel. You do not need to be affected by carpal tunnel. There are enough prevention measures available that everyone should be available to narrow down the chances of developing carpal tunnel. Remember, it's just not about you working safe. It's about the benefits of you working safe and it affecting your family. Now we're going to talk about back injury prevention and back safety. First, we're going to learn about some back injury facts. Understanding how back injuries occur, how to prevent yourself and others from developing back injuries, and using proper lifting techniques to prevent back injuries. Over 1 million people injure their backs on the job every single year. Annually, back injuries cost over $50 billion a year. Of all the work-related musculoskeletal disorders, 43% every year are back injuries. How do back injuries occur? Number one reason, bad posture. Not knowing how to lift correctly. Going down for a lift, not using the proper technique, using bad posture. This gets your back out of alignment, and when you put pressure on it, that's how it's injured. You lift too much. Your body is not capable of lifting, or it is in an improper position when you lift, and it is too much for your body to take. Heavy lifting should not be done. Most facilities have a 50-pound limit that you should lift by yourself. And if it is over 50 pounds, you should always get somebody to help you. Lifting above your head. Your body is in an unnatural position. Your spine is out of alignment. And with that, you are more susceptible to injuring your back. Your arms are stretched above your head. You are more likely to be off balance, trip, or fall. Lift properly. Lift with your legs. Keep the object close to your body. This is the most common lifting techniques and the proper lifting techniques. How do you prevent somebody else from being injured? If you see them, stop them. Show them the proper way to lift. Show them the proper way to be safe. Get help lifting. Like I said before, most facilities have a 50-pound max limit that one person should lift by themselves. If there's nobody else to help you lift, get a mechanical device, get a floor jack, get a forklift, get something, anything that would prevent you from being injured. Offer your help to somebody else if you see them trying to lift something more than 50 pounds or lift over their head. You have to learn the proper lifting techniques. There are 5 different lifting techniques. The most common, the straight back lift, bending at your legs, keeping the object close to your body, and lifting with your legs. Bend at the knees, the object close to your body, and lift with your legs. This will keep your spine in alignment and not be crooked or in an awkward position, which would end up you being injured. The next is the hip flex lift, the kinetic lift, the dynamic lift, and the pelvic tilt lift. Each of these you need to know. Each of these offer a very unique position for your body for the lift that's being done. Choose one of these, whichever it may be. You'll be more comfortable and more likely not to be injured. Each of these are very, very similar to the straight back lift. You just have to choose which is preferable to you and better for the job. Remember, back injury prevention is working safe for yourself and your family. Carpal tunnel prevention, it's working safe for yourself and your family. Remember, work safe. Thank you.